Thanks to everybody who's joined us today for the Mid-Atlantic ADA Center webinar, Reasonable Accommodation, Best Practices for Return to Work During COVID-19. It is a very hot topic of the moment. And our presenter today is Linda Carter Batiste, who is the Principal Consultant at the Job Accommodation Network. JAN is a service of the U.S. Department of Labor's Office of Disability Employment Policy, or otherwise known as ODEP. JAN does all things accommodation. I hand today's presentation over to Linda, and thanks so much for joining us.
Thank you, Carlene. And hello, everyone. Really appreciate the opportunity to join you today to talk about what I think is an extremely important topic, and that's reasonable accommodation and return to work during the pandemic. It's been a really, really difficult year for so many people, and just in my work at JAN, I can tell you it's been a really difficult year for employers who are trying to keep their businesses going, as well as for employees with disabilities who are not only trying to keep their jobs, but they're also trying to protect themselves from a potentially deadly virus. So it's created a lot of new questions about accommodations, a lot of ever-evolving, changing rules and regulations and laws other than the Americans with Disabilities Act that employers are grappling with. What I hope to do today is to provide some information and resources to hopefully make it a little less confusing when you're making reasonable accommodations and how to approach some of these tricky issues that are popping up related to the pandemic. We won't be talking about all the other laws that could come into play, but our focus today is going to be on the ADA and making reasonable accommodations in the workplace. On slide 10, my plan for today is to give you just a quick overview of the services that we provide at JAN and how we can help you in your efforts to make sure that reasonable accommodations are being made. And then I want to spend the bulk of my time with you today sharing some real life situations that have come into the Job Accommodation Network, real life situations that are occurring in the workplace. For each real life situation, I want to provide relevant ADA rules. They still apply. It's sometimes you won't forget that there are ADA rules and you just have no idea how to approach something. So we'll be talking about what rules might be relevant. I won't be going over basic ADA rules and regulations. I assume that most of you are pretty savvy about the basics. We're just going to be talking about relevant rules to the situations that I'm discussing. Along with that, we're going to talk about some best practices for how to deal with these situations. If there are specific COVID implications, I will share those as well. I have provided also some COVID-related accommodation examples. We may not get to those because of the time constraints today, but I wanted to share those with you in the PowerPoint that you'll be able to access after the presentation. These are from a survey that we do with employers that contact us. We call them or email them after the contact with us and ask them what really happened. Did they make an accommodation? What was it? We're starting to get some feedback about accommodations being made during the pandemic, and I've shared a few of those with you in the PowerPoint. And then we'll leave some time for questions and answers at the end. On the next slide, slide 11, let's start talking about JAN and what we do at JAN. Our main mission is to provide information about workplace accommodations, to explore accommodation ideas, to help come up with ideas, to provide any information that an employer or an individual needs to follow up with in order to implement an accommodation. The images that I provided on this slide, there are 4 of them representing various workplaces: a restaurant, healthcare, a science lab, an office setting, just to demonstrate that we provide accommodation ideas for any job, any industry, any disability. It doesn't even have to be a disability. If you just have limitations, whether they rise to the level of disability, we can help brainstorm accommodation ideas. So anything related to workplace accommodations, we can help you with that. Along with that, we provide practical guidance on the Americans with Disabilities Act, or ADA for short. We're not a legal service, so we're not giving you legal advice. Most of the information we provide is from the federal agency that enforces the employment provisions of the ADA, and that agency is the Equal Employment Opportunity Commission, or EEOC for short. The EEOC puts out a lot of guidance that is designed to help employers understand their obligations under the ADA and for individuals to understand their rights under the ADA. This isn't legal guidance from the EEOC, but if you follow it, it can be extremely helpful because the EEOC tends to err on the side of trying to make accommodations, trying to get people employed and keep them employed. And we do the same. So all the guidance we provide, if you want it, our goal is to give you whatever information you want to help make effective accommodations. So that's where we're coming from when we share information about accommodations and the ADA. And the other thing we do, in case anybody's interested, is provide resources for the self-employment of people with disabilities. So if you're an individual with a disability interested in starting or maintaining a small business, we have a consultant who can help you with resources for doing that. On the next slide, slide 12, I want to mention that we are a free service. As Carlene mentioned earlier on, we're federally funded so that we can bring you all the services free of charge. Contact us as much as you want to. There's never a fee for anything that we provide. I've provided an image on this slide of a map of the United States to demonstrate that we are a national service. We're available free throughout the United States and its territories. Under normal circumstances, you can call us on toll-free lines for one-on-one consultations about a specific situation. Right now, being forced to telework, we haven't completely figured out our phone system so that we can answer all of our calls live yet. We're working on that. You can still call and leave a message. We'll get back to you. But the easiest thing to do right now is to send us an email or get on our live chat and get direct service that way. And I want to mention that anyone can use Jan. Our primary customers seem to be employers and employees with disabilities, but there are no restrictions on who can use us. We get a lot of calls from family members, from advocates, from legal representatives for employers, healthcare providers, service providers. No restrictions, anyone can use us. The beauty of that, I think, is that we get to hear from a lot of sides to the accommodation equation. Hearing the issues that everybody has, I think, helps us come up with the practical guidance that we share to help get things moving. If you just know one side, then you may not understand the barriers that other side faces. So we get to hear all sides, and we think that's very useful. On the next slide, slide 13, the other thing that we have is an extensive website. This image on this slide is a picture of our homepage, which is located at askjan.org. We have lots and lots of information on our website. If you want to get on there and search for your own accommodation solutions or your own ADA information, we have a lot of different ways that you can search for information. I don't have time to go into a lot of detail about how to do that and what all we have on there, but get on there if you haven't been on there and just play around and look for stuff. If you have any trouble finding things, contact us and we'll walk you through it. One thing I do want to mention is our new coronavirus disease or COVID-19 page. It's on this tab right off of our home page. We put that on obviously in the last year to try to make it easier to find information about the pandemic. On the next slide, slide 14, I'll share a couple things that we have on the site related to return to work. One is accommodation strategies for returning to work during the COVID-19 pandemic. This has some general solutions for limiting the risk of exposure if you return to work, solutions to address physical distancing needs, and solutions to address communication needs. So it's a whole lot of ideas to explore if you need them, if you're not sure what accommodations you need. The other thing is for individuals who are requesting and negotiating accommodations during the pandemic, just some tips on how to do that. what to include. We recently, after I developed this PowerPoint, we actually published a couple more things that I want to mention briefly. Both are related to individuals who have had COVID-19 and have lasting limitations, the so-called long haulers or long COVID. We have one for employers who are trying to accommodate people with long COVID and some accommodation ideas. And then we have one for people with long COVID who may wonder whether they're covered under the ADA, may wonder what their rights might be to ask for accommodations. They may be new to the world of disability. So we've written a publication for them to help them understand what they may be entitled to in the workplace. On the next slide, slide 15, have a list of resources that we have on that page. I won't go over all of them, but just some publications related to how to do the interactive process, mask-related issues, stress-related issues, accommodations for individuals with hearing impairments. We have also recently added a couple other things that may be of interest. One is mandating vaccines, how that works, and one is making telework work. That one's about dealing with being forced to work at home, with your kids at home, with noises, distractions, with bad ergonomic setups, things like that, and some things that you can do to overcome some of those issues. So we have lots and lots of stuff to follow up with our presentation today if you need it. And again, I'm kind of going to do a broad overview of the things we're hearing. If you have questions, you can feel free to contact us anytime for follow-up questions. All right, so let's dive into our topic of the day on slide 16. Our first topic is going to be telework. This is the #1 issue that we have been hearing about nonstop since the beginning of the pandemic, and it is continuing to date. I provided a couple situations related to this topic. Starting on slide 17 is our first situation. The image that I provided for this slide is a picture of an employer and an employee sitting down in the office to discuss reasonable accommodations. And the situation is an employee asked to continue teleworking after her employer calls all employees back to the workplace after mandatory telework related to the pandemic. The employer tells the employee she will need to come into the office until the interactive process is complete. We have an employee asking to telework, concerned about her health related to the pandemic, and the employer says, well, we'll consider it, but you need to come in to process the interactive process, to complete the interactive process. So the question, is this a good approach? On slide 18, general ADA rule is that employers do not have to provide an accommodation until the accommodation process is complete. They have the right to get medical documentation and go through the process. But I would say that the employer in that situation is not taking the best approach. We have an employee whose health would be in jeopardy should they come into the workplace. I think a best practice in this situation is to allow employees to continue teleworking during the interactive process, especially if the issue is pandemic related and the person is at risk. For employers that contact us ahead of time, we always suggest, why don't you give people a head start? Let them know when you're planning to return everybody to work. Invite people to request accommodations at that time so that you don't get in a situation where you're telling people, come in tomorrow, and they're saying, no, I can't do that. So that's our best practice recommendation related to returning to work. Give people time. If you're an employer and you're concerned, well, if I let them continue teleworking, then they're never going to provide the information I want because they want to keep on teleworking. You can make the time frame temporary. You can say, okay, we're going to allow telework for a reasonable amount of time until you get us this documentation. Then you're going to need to come back into the office. On slide 19, I have another situation for you. The image on this slide is a picture of what appears to be a home setup, a telework setup with kind of a crappy computer with no ergonomics, kind of a stark looking design with no flexibility built in. And the situation is we have an employee who is teleworking who asks his employer to purchase an ergonomic chair and wrist rest for his home office. The employer says, nah, it's your responsibility to provide at-home equipment. Is this a good approach? On slide 20, the EEOC has been unclear about what equipment employers must provide for employees with disabilities who telework as an accommodation under normal circumstances. So let's take the pandemic out of it for a second. Back before the pandemic, it wasn't clear whether the employer had to provide equipment such as what this employee requested. Our best practice back in the day was to say, you might want to provide work-related equipment unless it's an undue hardship. It's not real clear whether you have to, but you've got an employee who's trying to work and needs better equipment. So maybe consider just providing it. For individuals that contacted us whose employer has said no, like the situation, sometimes we might say, if it's not that expensive, maybe you want to set it up, and then we provide some inexpensive or free ideas for trying to set up an ergonomic workstation. Maybe it's not worth arguing over or pushing if you can do it very inexpensively. So that's kind of been our best practice approach during normal, quote unquote, normal times. On slide 21, we've got some specific guidance from the EEOC related to this issue during the pandemic. And what the EEOC has said is that if an employee with a disability needs the same reasonable accommodation at a telework site that he had at the workplace, the employer should provide that accommodation absent undue hardship. And in our conversations with the EEOC informally, they've said that, well, even if the employee didn't need an accommodation in the workplace, if they're forced out on telework during the pandemic, the employer should consider accommodation requests, new accommodation requests related to teleworking. So this is something that is very exciting to us because it's a clear-cut rule that the employer needs to provide or consider providing equipment during the pandemic for telework. We don't know yet what's going to happen once the pandemic is over. Is this rule going to continue, or is it going to go away and we're back in uncertain land? We're going to have to wait and see on that. I wanted to mention that this question comes from an EEOC publication that is extremely helpful. If you haven't visited EEOC's site, which is www.eeoc.gov, and visit their information on the pandemic, there's a wealth of information that answers a lot of these questions. So take a look at that if you haven't already. All right, let's move on to our next topic on slide 22, and that is leave as an accommodation. So we're not talking about leave under other laws like FMLA, Family and Medical Leave Act, or a lot of state leave laws or some of this pandemic-specific leave laws. Just talking about leave as an accommodation under the ADA. It's confusing enough under the ADA, let alone adding in all of those other laws. I feel for employers and employees trying to understand what the requirements are, but we're just going to talk about one law here, and that's the ADA. So on slide 23 is our first situation related to leave. And on this slide, I provided an image with block letters spelling out recovery. We've noticed a major upswing in the number of questions we've received related to employees with substance use disorders who have relapsed during the pandemic, or employees who have developed substance use disorders for the first time during the pandemic. Very, very stressful times, and people are facing problems with addiction. So we're getting a lot of calls related to that. So here's an example of one situation that I had not too long ago. During the pandemic, an employee discloses that he is addicted to illegal drugs and wants to get help. He asks his employer if he could have some leave time to go to rehab. The employer has a zero tolerance policy for illegal drug use and terminates the employee under the policy. So the question is this a good approach? So on slide 24, let's go back to our quote-unquote normal ADA rules. And the normal rule is that current illegal drug users are not covered under the ADA, and employers can apply their usual policies. So this is still the same rule that applies during the pandemic. And our best practice here is one that we've been saying before and after the pandemic hit. And that is, we encourage employers to consider allowing leave When an individual comes to an employer and discloses a problem with substances, alcohol, or illegal drugs even, and asks to get help, we suggest considering allowing that. If an employer is concerned about a relapse or that the employee really won't go get help, they can consider using a last chance agreement. That's just an agreement that the employer develops with the employee saying, you've agreed to go get help, you've agreed to stop using illegal drugs, and if you do that, then we agree not to terminate you. If you violate this contract or agreement, you're going to be immediately terminated. So that's our best practice before and during the pandemic. Again, current illegal drug users are not protected under the ADA, so that's up to the employer to decide, but that's our best practice. On slide 25, another issue that cropped up during the pandemic is this situation. The image I have on here, it looks like a conference room with a bunch of empty chairs, nobody in the conference, illustrating this situation. An employee asks for leave until the pandemic is over. The employer denies the request because there is no end date and notifies the employee that he is being terminated. Is this a good approach? We've had so many questions related to employees saying, I just need to stay home. I can't telework. I just want to take leave until this whole thing is over, and then I'll come back to work. So on slide 26, the ADA general rule here related to leave in general is that leave must be provided unless it creates an undue hardship. But indefinite leave with no end date in sight might be considered inherently unreasonable. So in most cases, employers do not have to provide indefinite leave. So one of the questions is this considered indefinite leave? And I think there's an argument that it might be. We're getting closer to hopefully an end to the pandemic, so maybe it's not as much of an issue, but I thought I'd share it since it's still coming up. But what about just terminating the employee, saying, nope, you can't come back to work, you're terminated? A best practice, and actually I think a required practice, is to find out why the employee is asking for leave and talk to the employee about other options. Just because an employer cannot provide or doesn't want to provide the requested accommodation, that's not the end of the story. The employer should initiate the interactive process to talk about what's going on, why the leave is needed, and whether there might be other options for return to work. The employer could even say, well, we can give you 3 months leave, but we can't indefinitely give you leave. So that conversation needs to take place. If an individual is faced with that kind of situation where the employer denies the accommodation and shuts down the process, what we suggest is that the employee put something in writing saying, I've been denied leave as an accommodation. I want to talk to you further about this and look at whether there might be some other options to return me to work safely. And again, we have lots of accommodation ideas for reducing the risk of exposure that an employee and an employer and the healthcare provider could explore to hopefully move things along in this kind of situation. On slide 27, specific to COVID, to my knowledge, the EEOC has not directly addressed whether a request for leave until the pandemic is over is considered a request for indefinite leave. The image I have here on this slide is someone with a pen in their hand writing and writing what looks to be like a lot of creative writing to illustrate that the EEOC is encouraging employers and employees to be creative and flexible and not just shut down the process like the employer in the situation that I shared with you. So on both sides, try to be creative, try to be flexible, try to find a way to make this work until this situation is over or at least improved. All right, on slide 28, our next topic is mental health. We have received lots and lots of questions related to mental health, either for existing mental health impairments or for people that have developed new mental health impairments because of the stress of this pandemic. So I wanted to share a couple examples of what we've been hearing related to mental health. On slide 29, the image I have is a safety sign, a danger sign that has worker safety across the front of it. And the situation is that after returning to work during the pandemic, an employee with panic disorder requested a private office and asked not to have to interact with the public or coworkers because she feared catching COVID. The employer denied the request, stating that sufficient safety precautions were already in place. Is this a good approach? So on slide 30, the general ADA rule is that employers get to choose among effective accommodations. So the big question here is what the employer did effective or not. So a best practice, and again, I think this is an essential practice, don't assume that what you've done if you're an employer is sufficient to overcome an employee's disability-related limitations. Everybody's different. Every situation is different. You need to discuss the situation with the employee and find out what the employee's concerns are. For people with mental health impairments, it may not matter that you've done the recommended guidelines from CDC. That employee may still not feel safe. And there may be a specific reason why the person doesn't feel safe that you can find out what that is, and maybe you can address that specific issue with that employee. So this interactive process really needs to take place. For individuals in this situation, this is the same I recommended related to the leave example. Try to open the conversation back up. Put something in writing explaining to your employer why the precautions that are in place are not sufficient to meet your needs, and try to explain what your concerns are. We're very big on the interactive process, very big on going through this conversation. I think it can solve so many issues, so many barriers to making effective, reasonable accommodations. So you always want to make sure that that conversation takes place. On slide 31, I have another situation related to mental health. The image on this slide is a cute little kitty. I shared the picture of a cat to illustrate that emotional support animals are not always dogs. The situation involves an emotional support animal. An employee with anxiety asked to bring an emotional support animal to work. The employer denied the request because the employee did not need the accommodation before the pandemic. We got a lot of questions about this. I think employers were thinking that because this was hopefully a temporary situation, and we're still hoping that it is going to be over at some point, that they didn't need to provide accommodations, especially for employees that never needed them before. So the question is this a good approach? And on slide 32, I'd say no, that is not a good approach. The general ADA rule that applies all the time is that the duty to provide accommodations is ongoing. It does not matter that an employee did not always need the accommodation. And that's the same if an employee starts a job and later needs an accommodation. That duty is ongoing. Anytime the need for an accommodation arises, doesn't matter that the need for the accommodation is temporary. So a best practice related to the pandemic is to treat pandemic-related requests the same as non-pandemic requests, meaning don't worry about the fact that the pandemic may be temporary. If you get an accommodation request and there's a need right now, then you process it the same as you always would. If later it turns out the employee doesn't need the accommodation, you can revisit it at that time, but don't worry about the fact that the pandemic may be over at some point. On the next slide, slide 32, this is a quote from the EEOC. I'm sorry, 33. This is a quote from the EEOC related to people with mental health, and I shared this with you because I think it's very important to remember that although many people feel significant stress due to the COVID-19 pandemic, employees with certain pre-existing mental health conditions like anxiety, obsessive compulsive disorder, or PTSD may have even more difficulty handling the disruption to life that has accompanied the COVID-19 pandemic. So again, for employers, don't assume that what you're doing is going to help everybody. People with mental health impairments may have a specific issue that they need to address. So take those requests on a case-by-case basis, try to understand what's going on, and then try to accommodate the employee's specific limitations. On slide 34, I want to share one situation about service animals. One of my favorite topics. I love to talk about service animals as accommodations. Kind of an interesting issue came up during the pandemic, so I wanted to share that with you. So on slide 35, the image I have on this slide is a cute little black dog showing about half of its head, looking up with kind of a concerned look on its face. The situation is we have an employee who is blind who asks to telework because her service animal is not trained to social distance. The employer denies the request because it's about the service animal's limitations, not the employee's limitations. So the question is this a good approach? On slide 36, I would say no, this is not a good approach. The ADA rule is that employers must consider accommodations related to an employee's chosen method of overcoming limitations. I think employers get kind of hung up on the fact that an emotional support animal or a service animal is a living thing, and they forget that this is a way that an individual chooses to overcome disability-related limitations. I think a good practice here is to think of this as you would, for example, someone using a wheelchair. If you had an individual who relied on a wheelchair who said, I can't access the workplace right now because my wheelchair broke, or my wheelchair can't function in your work environment because of something in the work environment, you wouldn't say, oh, so what, come on in here without your wheelchair. It's the same thing with the service animal. If the individual can't get around without the service animal, then the employer may need to provide accommodations related to that service animal. On the next slide, slide 37, the CDC recommends that handlers keep their service animals a safe distance away from other people and animals. There haven't been a lot of research studies that have indicated that animals can get COVID or they're in danger, but there is some research that says they may get it, they could get it, they could pass it. So it's kind of up in the air a little bit. So the recommendation, at least the last one I saw, is that handlers be careful with their service animals and keep them away. But like I said, most service animals are not trained to social distance. Nobody knew this was an issue, and a service animal, especially for a guide dog, doesn't know how to social distance. So this could be definitely a problem for people who rely on their service animals to get around. All right, our next topic on slide 38 is commuting issues. This is always an interesting topic, even without the pandemic, and it's become even more interesting during the pandemic. So I wanted to share an example of this issue. So on slide 39, got a picture here, an image here of someone driving in traffic. Looks like a 4-lane highway with lots of cars on it. And the situation is an employee with irritable bowel syndrome asked to work temporarily at an office closer to her home to avoid having to use public restrooms, because public restrooms mean exposure to viruses with other people being in the restrooms. Plus, a lot of restrooms have been closed in a lot of retail establishments. So another problem this individual may encounter is even finding an open restroom. If you can't make it to work without using the restroom, it's going to be hard to do your commute. The employer denied this request, however, stating that employees are responsible for getting themselves to work. It's not my problem. Is this a good approach? On slide 40, I'd say no. This is not a good approach. I think this is a kind of confusing issue for employers because the general ADA rule is that employers do not have to provide transportation to and from work. So they don't have to go get the person in their car unless they provide transportation for everybody. But employers sometimes take that rule and they take that to mean they don't have to provide any accommodations related to commuting problems. The EEOC has said that employers might have to consider other accommodations related to commute problems, such as modifying a schedule or modifying where the employee works, such as allowing them to work from home. And this is the reasoning behind this is that employers don't control how somebody gets to and from work, but they do control the individual's schedule and they do control where the workplace is. So those are things that the employer might have to modify unless modifying them creates an undue hardship. So a best practice for employers who receive these kind of requests is treat the request as you would any other accommodation request, and consider accommodations such as modifying an employee's schedule when they have difficulty commuting to work. On slide 41, another COVID-specific issue. The image here is an individual with a disability who is getting off of public transportation. Employees who rely on public transportation have been having a lot of problems safely commuting to work, either because public transportation shut down, at least accessible transportation, or because they are at risk if they get COVID and there's too many people still on public transportation, even with social distancing. So we've been hearing a lot of things about employees who need to continue teleworking because of commuting problems using public transportation. In this case, we're encouraging employers to consider temporary telework until this issue is addressed, or hopefully the pandemic goes away. All right, on slide 42, another topic I want to talk about is job restructuring, and I have one example for you here, and that's on slide 43. The image I shared on this slide is a healthcare professional who is talking on the phone and has a stethoscope around her neck. The situation is, during the pandemic, a nurse was excused from seeing COVID-19 patients, but the employer asked her to start seeing them again after the number of patients rose. The nurse flat out refused to do this, so the employer said, "You're fired." Is this a good approach? On slide 44, I do not think this is a good approach. Even though the general ADA rule is that employers do not have to excuse an employee from performing essential job functions as an accommodation. So in this case, this employer decided to excuse this person, but when they needed her to step back in and do it, they could do that. They can require her to do it. But again, a best practice here is to go through the accommodation process and explore other options. Just like I talked about before, you don't want to just say no and stop there. But an employer cannot do the requested accommodation. That's not the end of the story. You need to open this back up and see if there are any accommodations that would enable this individual to safely do the job. And don't forget, reassignment can be a reasonable accommodation. If this person just cannot do that job safely, then maybe reassignment would be an option. If you want to look at doing that temporarily during the pandemic, that's great. If both parties agree, let's do this temporarily, and then when this is over, I'll go back to my usual job. That's been something that employers have been very receptive to. This issue has been coming up a lot for teachers. The question is, when teachers are being required to return to work, they've been teaching virtually. Is teaching virtually removing an essential function of being in the classroom? Can the employer say, no, you can't teach virtually anymore. You've got to be able to come into the workplace and perform the essential function of being here to monitor children. That's a judgment call for the employer to make. A lot of employers are saying, we think that is essential that you be here, that we don't feel like you can do it virtually once the kids return to the classroom. Again, we're encouraging employers to be creative, to try to work this out so that teachers don't lose their jobs or be forced to be on leave longer than they need to be. But that's a judgment call on the employer's part. They have to be able to back that up should an employee file a complaint. But that is generally the employer's purview to say whether something's an essential function or not. We're hearing that a lot with teachers and returning to the classroom. On slide 45, specific to the pandemic, the EEOC has made a very clear statement that the fact that an employer temporarily excused performance of one or more essential functions does not mean that the employer permanently changed a job's essential functions. And I'm really, really glad that the EEOC published this statement, because employers are often afraid to temporarily remove an essential function, believing that, well, I'm never going to be able to restore this, and I really need this person to go back to doing this eventually. So this is clear cut that it's okay to do that temporarily, and you're not going to be locked into doing that forever. And I think that gives employers the freedom to be flexible right now and to consider temporary accommodations like removing essential functions, even though not required to do so. All right, on slide 46, I want to talk about medical documentation and share one example with you. This is a very important topic, very confusing topic, I think. So on slide 47, the image here is a lot of medical looking equipment, and the situation is an employee with diabetes has been teleworking for months during the pandemic. The employer wants to review the accommodation and ask the employee for medical documentation. Is this a good approach? So on slide 48, the general rule is that employers can require medical documentation when the disability and need for accommodation are not obvious or already documented. So the answer to this situation, this issue, depends on the situation. Did the employer previously get documentation? Was this an employee who was teleworking because everybody was and there was never any medical documentation? If so, the employer can get it now. If the employee is asking to continue teleworking as an accommodation, the employer can get that documentation now. If the employer already got that documentation, there needs to be a valid reason to ask for something new. And that usually means there was some kind of change. The situation changed, the employee's disability changed or limitations changed. Something has to trigger a request for new documentation. So in this case, if the employee has diabetes, it's still on the CDC's at-risk list. Unless something else changed, then the employer probably does not need new medical documentation. So a easy best practice here, I think, is don't ask for new medical documentation unless necessary. Think about, what do I need? What do I already have? And why would I be asking for something new? What is missing? So make sure you ask yourself, why do I want this? Why do I need this new documentation? If you don't have a valid reason, then don't ask. If an individual gets asked for new medical documentation and doesn't think there's a valid reason, what we usually suggest is put something in writing, which we're real big on doing, so there's a record, and just ask, why I provided all this like 6 months ago, why are you asking for new information? Nothing has changed. I don't understand. That shows that you're not saying no, I won't provide it, but you're at the same time questioning it. On slide 49, the general rule related to COVID is to consider using those CDC guidelines to verify that someone's at risk. Don't make somebody, for example, with diabetes, verify they're at risk. CDC already says they are, so maybe use that and don't make somebody go to the doctor to get that. On slide 50, I want to talk about one more topic, and then we'll open it up to questions and see if we have any questions. If we don't have a lot of questions, I'll move on to some of the other things that I have here. But I wanted to talk quickly about vaccines. This is the new wave of questions that we're getting as the vaccines became available. We started getting lots and lots of questions about vaccines at work. On slide 51, my image is, of course, a picture of someone's gloved hands holding a vaccine. The situation is, as vaccines are becoming more widely available, an employer wants to require at-risk employees to return to the office instead of teleworking. So is this a good approach to say, hey, vaccines are available, you're maybe at risk, but you get a vaccine, you come into the office, you don't need to telework anymore? On slide 52, I'd say no, that's not a good approach. Even though the general rule is that employers only have to provide accommodations if they continue to be needed, it's not clear-cut if someone gets a vaccine, whether it's safe to return to work if they're at risk. Plus, don't assume that vaccine availability negates the need for telework. Some people can't get a vaccine. You can't make that assumption just because we have vaccines. You need to take a case-by-case approach. If you're an individual and your employer says, get back to work, the vaccine's available, you can't take it, or you have a valid reason why you're not going to take it, let your employer know that and go back to square one with making sure the employer understands you still need that telework accommodation. On slide 53, EEOC has some guidance in the publication that I mentioned earlier that you can find at www.eeoc.gov. Many questions related to vaccines and answers from the EEOC. One of the things that EEOC clearly says, if an employee cannot get vaccinated for COVID-19 because of a disability and there is no reasonable accommodation possible, then it's lawful for the employee to exclude the employee from the workplace. But that does not mean you can automatically terminate the employee. That means you go back to the accommodation process, see if you can accommodate, for example, ongoing telework, or maybe leave until it's safe to return to work. So that doesn't mean you just can the person just because they can't take the vaccine. All right, on slide 54, I'm going to hold this topic. It's, like I said, kind of self-explanatory. I want to get to some of your questions if we have questions. Again, if we don't have enough questions, I will come back to this topic. Carlene, do we have any questions at this point?
Hi, we did get one question that came in. It looks like it's a scenario. So this says, we had a state government agency in which the employee has been working remotely since the pandemic started and remained working remotely after many returned to the office saying that they're high risk. The employer has asked the employee to come in 1 day a week and has gloves, masks, and has taken the CDC steps, recommended steps for employees. The employee has a private office and is still refusing to accept 1 day a week. The employee has some high-risk conditions, and but now the employee is saying that they are too high of risk to come in 1 day a week. Their job is administrative and they are in a supervisory role. What is your recommendation in this situation?
That's an excellent question. And that goes back to what we talked about with the interactive process. The employee has said, I'm still at risk and I still don't feel it's safe even with what you've done. And if you haven't already asked for some medical documentation to help sort that out, that could be your next step. You could write down exactly what all you have done to try to ensure that this employee can safely return to work. And you can ask the employee to take that to the doctor and explain what else is it that's putting this individual at risk. We talked about commuting to and from work. That can be a problem for people depending on the commute. The person could be so severely at risk that even a small chance of getting COVID-19 could be deadly to the person. You want to get some input from the doctor about what you've done and why that may or may not be sufficient. It could be that the individual's just anxious about returning to work. We've had that come up. If the person actually also has a mental health impairment that is being exacerbated by that fear, then that can be another way that you may need to provide accommodations for this person. But having that conversation and getting some medical documentation, what exactly is it that you fear with all these precautions in the place? Where do you think you're going to be exposed? What is it that is concerning you still with all that we have done? And you may find out that it's something that you can address and fix. You just need to have that conversation and get the medical documentation if you think that would be helpful. It could be something you're just not aware of or the employee has not been comfortable sharing at this point. With the fact that the person's a supervisor, if you take a look at the telework, has the person been effectively performing the job or did you remove essential functions? Is someone else doing the work? If the person is not fully performing the job from home, you may want to make sure that the individual is aware that we've been removing an essential function if you haven't made that clear before. And we are no longer going to be able to do that. We've got to find a way that you can perform your job fully. So let's talk about that. Some individuals may be creative about, well, here's how I'm going to do that even if I telework full time. Maybe not, but in some cases, you know, again, that conversation is so important. You want to have that. If at the end of it you still can't accommodate, then you've demonstrated that you made a good faith effort. You got the employee's input, you got the doctor's input. contact us. Contact the ADA network. We can brainstorm ideas with you. We're happy to see if we can add anything to the conversation. So you can always contact us as well.
That's great. Thank you. Sort of a follow-up question to that. If the employer has gone through the effort of doing all of those CDC accommodations and requirements, and they're doing everything as safely as possible, does it matter if the employee agrees? Do you still go through that process?
Absolutely. The CDC guidelines are general guidelines. Accommodations are very specific to an individual's specific disability and limitation and risk factors. So yes, you absolutely need to go through that process. And again, as I mentioned, people with mental health impairments, for example, it may not be the actual exposure, but the feeling of not being safe based on what you've done so far. There may be one other thing that you can do for this particular individual to make that person feel safe. And you need to go through that process for any type of disability, because you don't know, you cannot assume that just doing those general CDC guidelines are going to ensure the safety of the individual or ensure that the person feels safe enough that their anxiety is going to be under control enough to come into the workplace. So yes, appreciate that question, because that is something that we get asked a lot. And I think that's really, really important to understand that, yes, you do still need to go through that process, even though vaccines are available, even though you have CDC guidelines in place. Go through the process.
Thank you. A couple of vaccine questions. Can an employer make you turn in proof of vaccination?
My understanding is yes. If your employer mandates vaccines, they can ask that you show that you had a vaccine. That doesn't mean that if you can't take the vaccine, you still have a disability that interferes with taking the vaccine, you can ask for an accommodation to not take that vaccine, and then you go through the interactive process. But if you can take the vaccine and your employer mandates vaccines, ask everybody to verify that they've had it, yes, my understanding is that the employer can ask you to verify that.
So since there is a vaccine available, wouldn't that be enough reason to ask for updated documentation to address, say, indefinite telework?
It might be, yes. If an employer requires employees to get the vaccine and an individual with a disability doesn't ask for accommodation, gets the vaccine, then I think that is a situation where you might have a valid reason to say, hey, can you safely come into the workplace now? Everybody's vaccinated and only people with vaccines are coming into the workplace. We've got all these safety precautions in place. Can you safely return to work? I think that is a valid reason to ask that question and to follow up with individuals who are at risk, who have been teleworking to avoid exposure. And if the individual indicates, no, I'm still at risk, I still can't come in, then I think medical documentation in that case to help you understand why that is, and to look at whether, well, are there other things we could do that would enable you to come in. I think that's a valid reason to get updated information, because there's something new that has entered the picture, and that's the vaccine.
And that, kind of a follow-up question to that. So what you're saying is, if someone receives the vaccine, but it doesn't really seem to be as effective as it could be for a particular disability, that person may still be considered for reasonable accommodation, such as telework, even with the vaccine.
Yes,
okay?
That's exactly right. That don't assume just because someone gets a vaccine that they can safely return to work. Ask or let everybody know that once the vaccines are in place, you're going to require everybody to return to work. Invite people with disabilities, employees with or everybody. Let everybody know that they can ask for accommodations if needed. People with disabilities, you may have other protected categories that may be able to ask for accommodations as well.
Gotcha. So we had somebody ask, so let's say the employee has a family member who is very high risk, and the employee is willing to work remotely. Would that be a kind of reasonable accommodation even though it's for a family member?
That's an excellent question, and we still get that all the time. The ADA does not require that employers accommodate employees who do not themselves have disabilities. They do not have to provide accommodations if it's the family member that has the disability. The thing that employers need to be careful with is they need to at least offer to employees in that situation the same kind of accommodations they offer generally to all employees. So if you're letting people telework because their kids are at home, for example, you're letting them work at home for whatever reasons, and an individual says, I need to telework because I have an at-risk child with a disability, you don't want to treat that person less favorably than you do everybody else just because there's a family member with a disability. So while you do not have a duty to accommodate, you have a duty to treat that person equally, same benefits of employment that everybody else gets.
And then, of course, the big question, can the employer require all employees to be vaccinated before returning to work?
My understanding is that the ADA does not prohibit employers from mandating the vaccine. But if you have an individual with a disability who says, I cannot get the vaccine because of my disability, you need to consider accommodating that individual. And that means, can you provide accommodations that would safely enable the employee, that particular employee, to return to work? Or can you allow telework or some other accommodation that would keep that individual employed? So the ADA doesn't prohibit employers from mandating the vaccine, but that's not the end of the story. You still have to consider accommodations.
Gotcha. So here's another question. Let's say that the employer is aware that there are a couple of employees who are high risk, but the employee hasn't asked for a reasonable accommodation. Is it appropriate for the employer to initiate a reasonable accommodation in that situation?
So under the ADA, if an employer has a reasonable belief based on objective evidence or knowledge that an individual may need an accommodation, it's okay to ask the individual, hey, do you need an accommodation? I have this knowledge and this is going on. I just want to check with you to see if you might need an accommodation. That's allowed if the employer has that reasonable belief. But forcing an individual to accept an accommodation is different. If the individual says, I don't need an accommodation, I don't want an accommodation, then the employer should leave it alone unless the employer can demonstrate that allowing that individual to stay in the workplace is a direct threat, either to the individual or to others. And that's a very high threshold for an employer to meet. I don't begin to advise employers on whether they can meet that or not, but that's the standard. If the individual does not want an accommodation, let it go unless there's a direct threat issue involved.
That's great. This is really helpful information, but we are out of time. We're at the top of the hour. So we're going to have to finish up. But Linda, I want to thank you again so much. That was really, really helpful advice. And, hopefully listeners out there follow up with you, if they have additional questions or if their question wasn't answered for today. I want to thank you again for joining us today. Again, really helpful information. I strongly recommend, and we refer to you all the time, that you contact the Job Accommodation Network or visit their website, which is askjan.org. Linda, did you have any additional information you wanted to add before we finish?
I just want to say I really appreciate you inviting me today, and I hope the information was useful. And as Carlene said, if anybody has additional questions or follow-up questions, get on the Jan site, and we have lots of ways to contact us. You can contact me specifically if you want, or any of our consultants can help you.
And you can also give us a call at the Mid-Atlantic ADA Center at 1-800-949-4232 or locally 301-217-0124. Again, thank you so much, everybody, for joining us today. We hope that this was helpful information for you as well, and enjoy your day. Bye.